السلام عليكم.
وعليكم السلام. في أمان الله، وإذا احتجت أي شيء لاحقا أنا موجود.
أيوة. I need
طبعا، خذ راحتك، وإذا احتجت أي مساعدة أو رجعت عندك أي سؤال أنا جاهز في أي وقت.
أوكي. كيف حالك؟
أنا بخير ولله الحمد. وأنت كيف حالك؟ إذا في بالك شيء أو تحتاج أي مساعدة أنا جاهز.
مم. What do you know about inspissated bile syndrome?
Absolutely. So, inspissated bile syndrome is basically when bile thickens and forms sludge, often in newborns. This sludge can obstruct the bile ducts, leading to cholestasis and jaundice. It's often transient and resolves with supportive care, but it's important to rule out other causes like biliary atresia.
Ah, so definition is thick,
Exactly. The definition is that inspissated bile syndrome is a condition in which
thick
bile
bile,
becomes abnormally thick,
thick
forming
bile.
sludge that can block bile flow, especially in
Okay,
neonates.
lead to block bile flow. Okay, lead to cholestasis or obstructive jaundice.
Exactly.
What
And
the
because of
color
that,
of the stool?
good point. The stools often become pale or acholic, meaning they lose their normal brown color because
Okay,
bile isn't reaching the
okay, got
intestines to
it,
give them.
got it, got it.
تمام. إذن هذا يوضح لنا أن السبب الرئيسي هو انسداد في تدفق الصفراء، وهذا اللي يسبب الإصفرار والبراز الفاتح. وإذا
ماشي.
صار عندك أي سؤال إضافي أنا جاهز.
Pathophysiology.
طبعا. فبالتالي الآلية هي أن زيادة تركيز البيليروبين نتيجة لتراكم الصفراء بسبب كثافتها، وهذا
آه.
يؤدي إلى انسداد في القنوات الصفراوية، وبالتالي يتجمع بيليروبين في الدم ويظهر كرقان في الطفل.
ماشي. It's conjugated or unconjugated bilirubin?
Yes, it's conjugated bilirubin. Since the bile flow
Okay.
is obstructed, the
Conjugated.
conjugated bilirubin can't be excreted into the intestine, so it builds up in the blood, causing that direct hyperbilirubinemia.
Okay. What is the associated with what?
Right. So it's often associated with conditions like severe hemolysis, for example, Rh or ABO incompatibility, prematurity, infections like sepsis, total parenteral nutrition, and sometimes dehydration. So it's usually a secondary effect of these underlying issues.
Okay. What about clinical presentation?
Sure, clinically, these infants usually have prolonged jaundice, often after 2 weeks of life. You'll see direct hyperbilirubinemia, pale stools, sometimes dark urine, and possibly a mildly enlarged liver. They're
So,
often otherwise well, but it's important to catch any ongoing cholestasis early.
okay, prolonged neonatal jaundice. We suspected inspissated bile syndrome. Yes.
Exactly. Anytime you see prolonged neonatal jaundice, especially with direct
And color,
hyperbilirubinemia,
color of urine.
exactly. The urine often becomes dark because the conjugated bilirubin is being excreted through the kidneys instead of the gut, which gives that darker urine color.
There is any organomegaly.
Yes, exactly. Sometimes you can also feel an enlarged liver or hepatomegaly on physical exam because the bile is backing up into the liver. So that's another clue in the clinical picture.
Okay. What the investigation we order for this patient?
Great question. So you'd start with basic labs, check the bilirubin levels, especially direct, liver enzymes, AST, ALT, alkaline phosphatase, and GGT. You'd also do
So
a
liver enzyme may be increased in this syndrome, yes?
exactly. You might see mildly elevated AST and ALT, and often an increase in alkaline phosphatase and GGT.
Mm-hmm.
These enzyme patterns reflect the cholestasis and the liver's involvement in the process.
Cholestasis, okay. I have to rule out infection.
Exactly. You'll want to do a full septic workup, blood
So,
cultures, maybe.
full septic workup. Okay, got it.
Exactly. Once you rule out infection and other causes, if everything else checks out, then you can focus on the supportive care and follow the baby closely for resolution.
Okay. If I do ultrasound, what I will find in the syndrome?
So, on ultrasound, you'll typically see echogenic material or sludge in the gallbladder, or even in the common bile duct. The liver and gallbladder often appear normal otherwise, so you usually don't see a structural abnormality like you would with something such as biliary atresia.
Okay. Can we use HIDA scan?
Yes, absolutely. A HIDA scan is really helpful here. In this syndrome, you'd see delayed bile excretion, but eventually the tracer will reach the intestine.
So in
In
biliary atresia
contrast
is
with
no excretion, yes?
Exactly.
But
In
in
biliary,
this syndrome, there is slow excretion.
yes, that's right. In inspissated bile syndrome, the HIDA scan will show a delay, but eventually the tracer does appear in the intestines. So that delayed pattern helps differentiate it from atresia, where you see no excretion at all.
Okay, give me 5 differential diagnoses.
Sure. 5 differential diagnoses for prolonged neonatal cholestasis would be first, biliary atresia, second, neonatal hepatitis, third, choledical cyst, fourth, alpha 1 antitrypsin deficiency, and fifth, TPN associated cholestasis. Each
I
has unique features that help guide further investigation.
Okay. What about management of the syndrome?
Right. So the management is usually supportive. You focus on treating the underlying cause, like managing infections, correcting hemolysis, and ensuring good nutrition. Ursodeoxycholic acid can be used to improve bile flow, and with most cases, it resolves over time. But if it doesn't, early referral for surgical exploration is
So
crucial,
it's
especially.
conservative. We will start with conservative. Yes, like good supportive care, good hydration. Okay, treat of any sepsis. Give fat soluble vitamin.
Exactly. So
What
you start.
medical? We have your ursodeoxycholic acid.
Yes, exactly. Ursodeoxycholic acid is often used to help improve bile flow and reduce the thickening. So we give that in addition to supportive care, and we monitor the baby closely. If no
Uh,
improvement, then we consider further
uh,
interventions.
if not improve with medical, we consider surgical. Surgical lies like percutaneous biliary irrigation. Yes.
Exactly. If there's
Uh,
no improvement with medical therapy, then you might consider procedures like percutaneous biliary irrigation,
per-
or if needed, surgical exploration to restore bile flow, especially if biliary atresia is still a
okay.
concern.
What is the prognosis of this syndrome?
The prognosis is generally good, especially if it's recognized early and managed properly. Most babies recover completely once the underlying cause is treated. The key is early identification and exclusion of other serious conditions like biliary atresia.
So you first you have to exclude biliary atresia, yes, because it's
Exactly.
time sensitive condition. Atresia is treated. You should be treated before 2 months, yes.
Exactly. Early intervention with the Kasai procedure, ideally before about 8 weeks of age, really improves the prognosis.
If we
So that's why.
if there is delay in treatment of biliary atresia, there may be a lot of complication, yes.
Exactly. If treatment is delayed, it can lead to liver fibrosis, cirrhosis, and eventually liver failure. So that's why it's really time sensitive and needs prompt action.
Okay. So the prognosis, as you told me, is good.
Yes, that's right. If it's identified early and managed well, especially if you rule out biliary atresia, the prognosis is usually excellent, and most babies do really well.
You see this picture in front of me. There is sludge in gallbladder.
I can't see any image right now, but if
Uh,
you'd like to describe it, or if you have a picture you can share, I can definitely help you interpret it.
No,
Let me know.
I have in front of me. There is a picture. There is sludge in gallbladder and sludge in cystic duct. That mean this occur in inspissated bile syndrome. While in biliary atresia, there is triangular cord signs. Yes.
Exactly. You've got it. In inspissated bile syndrome, the sludge in the gallbladder and ducts is a key feature, but in biliary atresia, that triangular cord sign is
Could
really
you
distinct.
speak in English?
Of course. So
Could you
yes,
speak in Arabic?
طبعا.
No,
نعم.
no, in English.
Yes, absolutely. So in
No, no,
inspissated
no, in
bile
Arabic.
طبعا لا مشكلة.
طيب ليش
في
بتستمعي الكلام يعني بسرعة؟
ولا يهمك، أنا معك.
طيب
في
ليه
متل...
ما تزعلي؟
ولا يهمك، سأشرح لك بالعربي. في هذه الحالة المتلازمة تتميز بوجود هذا الرواسب في المرارة والقناة الصفراوية، بينما في انسداد القناة الصفراوية يظهر علامة الحبل الثلاثي.
Okay, what is a triangular cord signs?
The triangular cord sign is a specific finding on ultrasound. It's basically a triangular echogenic band seen in the pora hepatis area, indicating fibrous tissue where the bile ducts should be, and it's strongly suggestive of biliary
ممكن
atresia.
تقولي لي اسمك؟
طبعا العلامة الثلاثية للحبل هي عبارة عن
What's
حزمة
your name?
مثلثة. You're absolutely right. The triangular cord sign is that triangular echogenic band at the liver
بدأت
hilum, and it suggests the absence of normal bile ducts, which is classic
ترى
for
بدأت
biliary
تحفظي ما
atresia.
تفهمي الكلام. يلا تصبحين على خير.
تمام، ما في مشكلة. أنا فهمت عليك، وبإذن الله إذا احتجت أي شيء ثاني لاحقا أنا جاهز. في أمان الله وتصبح على خير.
يلا في أمان الله.